We're pleased to welcome now Mr. Douglas Carswell, President and CEO of the Mississippi Center for Public Policy. Good to see you there, Douglas. Happy New Year to you.
Happy New Year, Gerard. Happy New Year, Mississippi.
Well, you got your hands full because we got a session that's going to get started right now, as a matter of fact.
We have, and isn't it exciting? A 4-month, completely new session, new speaker. It's going to be great.
Yeah. What are you guys working on at Center for Public Policy? I do consume your newsletter, enjoy reading those. Typically Saturdays is when I think I receive those.
Saturday every week they go out, yep. We've got 4 key priorities for the session. Our number one priority is education freedom. By that we mean giving parents control over their child's tax dollars. You're going to hear lots of different people talking about different types of education reform, and there are lots of things we support, but the key in all of this is EFAs, education freedom accounts, doing what Arkansas has done, doing what an increasingly large number of states across America have done, giving every family control over their tax dollars and allowing them to spend those tax dollars at any school of their choice, public school, private school, charter school, whatever school they want. That's our number one priority. We also think we need tax cuts. Look at the Southern success story that we see from sort of Tennessee to Texas, from Alabama to Atlanta. If we want to be part of that, we need more tax cuts. We went a long way towards reducing the income tax down to 4%. We need to go further. We need more tax cuts. A couple of other things. Healthcare. Healthcare is not just a real problem for people on average incomes. It's actually an economic problem. If you don't have affordable healthcare, it puts people off from investing and coming into Mississippi. Rather than hosing tax dollars at the problem, we think we can remove a lot of the restrictions, the certificate of need restrictions. We're really excited that the governor and the speaker are committed to reforming certificate of need. We're about to publish a paper on how to abolish the certificate of need restrictions. This will lower the cost of healthcare for ordinary folk in Mississippi.
Explain to the audience exactly what that is, certificate of need, the so-called CON laws.
The appropriately named CON laws. They're CON by name and by nature, but CON actually stands for certificate of need. These are a bunch of laws that were introduced a generation ago to limit the supply of healthcare providers. So if you have a healthcare facility, you basically need a permit. Think of it like the Soviet Union. You need a bureaucrat to give you permission to expand a healthcare facility. Now, this was brought in for all sorts of well-meaning but ridiculous reasons 40 years ago. It's become a bit of a scam. It's a way of the existing providers guaranteeing they won't get outside competition. And what that inevitably does is pushes up the cost of healthcare for the rest of us. And if we remove these restrictions, we would see much more choice and competition in the healthcare economy in Mississippi, and people would get much better value for money. It would drive down the costs of healthcare without spending a single extra federal dollar. There are things we can do here in Mississippi to actually lower the cost of healthcare. Something does need to be done. Quite rightly, there are those who say we should expand Medicaid. If you expand Medicaid without removing the certificate of need restrictions, you're just going to drive up the cost of healthcare for everyone else. You need this, what economists would call supply-side reform.
Yeah, so I kind of describe, I've been crusading to repeal the CON laws for, it seems like 20 years. It's been a long time. Mm-hmm. And it seems like we get real close every year and can't get it across the finish line. I kind of describe it this way. It would be sort of like Wendy's asking the local McDonald's for permission to open up a Wendy's across the street.
Yep. We wouldn't put up with that, would we? We wouldn't put up with a situation where you needed the permission of a rival provider to expand. Yet this is what we have with healthcare. You say we've come close. Actually, we haven't come that close because, mysteriously, the people in charge of the relevant committee in the House have never allowed the bill to actually, disgracefully, they've never allowed the bill to actually come before the House in a vote.
Not the whole House, right. Yeah. Can't get it out of the committee.
If we can get it out of the committee this year, and I think we need to cause a real stink if we can't. If we could bring it out before the House, I think we could make the argument quite convincingly that now is the time to remove these restrictions. Okay. We've got a paper out this time next week that shows how it can be done. It would actually improve healthcare for ordinary Mississippians.
Okay. So I'm all for it, by the way, just to be clear. But I do have a concern. And the concern is that it may lead to the establishment and creation of new outlets of healthcare delivery, but that may occur in areas that are not, let's say, the where it's most urgently needed. I think in the areas where we most urgently need access to care, unfortunately, is where our least healthy population is, and our lowest income population. And I'm not sure that we've got like a long list of healthcare providers that are saying, yeah, I can't wait to get rid of these CON so I can go open up shop and serve a sick population that doesn't pay.
It's not going to fix every problem. Yeah. And I think it would be naive.
It's not a reason not to do it. Let me be clear on that.
There's not a silver bullet, and I don't think one should pretend.
Agree. Okay.
But, I think actually the time to remove these restrictions is now.
Agree.
And, there are other things that will need to be done, particularly for rural care. But I think removing certificate of need is urgent.
Yeah, I'm with you. It's just the right thing to do. I mean, from a principal perspective, I trust the market more than I do central planners making the decision of who can buy a CT scanner, for example, which is there's a long list, as you're aware of, in the certificate of need statutes. That
take something as obvious as long-term care.
Yeah. That's a big problem.
We haven't allowed more long-term care beds, and there's been demographic change. So older folk are living longer. We need more of them. Yeah. It's insane that we've not allowed the market to adjust to the demand.
Totally agree with that. And I think we would see some movement in those arenas for sure. Maybe this is the year, right, that we can get this done.
Fingers crossed. I mean, at least if we could allow it to have a proper vote of the whole House.
I agree.
And it's frankly disgraceful that vested interests have prevented that previously.
That's right. And there's a strong lobby in opposition of it, as you very well know. And so we'll see where all that goes. All right, so you also mentioned tax reform. As you know, we got what I often describe as a down payment on full elimination of the income tax. We got rid of the 4% bracket. We're phasing out the 5% so that when at the end of the day, in 3 years, we'll have one single bracket of 4% on taxable income. Where do you see that going?
I think it's really good that we moved to a flat rate, but wouldn't it be even better if the flat rate was zero?
Sure.
It's zero in Tennessee. It's zero in Texas. It's zero in the growth states in the South. Look, I don't have a obsession with income tax. There are other taxes that we could eliminate. There are things we could do for inventory taxation, for example. But the fundamental is that we have a big budget surplus, and we have a danger that if we don't give that surplus back to the taxpayer, politicians will invent new ways to spend that money. And actually what will happen with the surplus, it will become a sort of form of institutionalized recurring state revenue. You'll get the growth of the state government, and that is a real danger. So I think we need to see ideas come forward. Eliminating the grocery tax might be one idea. Eliminating the income tax might be one idea. But there are things we could do. I think sensibly we could perhaps bring forward the phased reduction in income tax. Perhaps instead of a flat 4%, maybe we should use some of the surplus to nudge towards a flat 3%. We've got to make sure it's affordable. But the idea that a lack of affordability is what's keeping us back, the surplus figures just don't add up.
Now we'll see if those are sustainable. I mean, that's the question. And I've talked to legislators who expressed that concern that this was an aberration for the 3 years that we've produced pretty substantial surpluses. That is not really sustainable and won't continue to occur. Something I have concerns about. Get your take on that is the Public Employees Retirement System's PERS. You may have seen the article that I drafted on that. I believe that's weighing in on this idea of tax reform as well. It's an expense the state may have to bear here.
We published a list of our priorities. One thing we would like to see is action on PERS.
Okay.
I think we need to take action that doesn't impact existing recipients, but young people who are signing up to join the PERS system, who are joining the labour market now, they need to move from what's known as a defined benefit system to a defined contribution system. And if we don't do that now, our grandkids are going to have a kind of European-type tax bill. I totally get that people who've, in good faith, been members of the PERS scheme for years, reached retirement, yes, we need to honour what the system said would be paid out to them.
Okay.
But new people going into the labour market now should move away from a defined benefit system to a defined contribution system. Incidentally, the private sector across America has been doing that for years.
It's certainly more tantamount to what we find in the private sector. The question is, will we also have to adjust base salary up as a way to compensate for the loss of that future benefit. I mean, those are discussions we need to be having for sure. Yeah. So if you can hang around, we can talk some more about your priorities. And I'd love to get back to the school choice topic as well. Wonderful. You mentioned that as a top priority.
It is our number one priority.
We got Douglas Carswell, President and CEO of the Mississippi Center for Public Policy, in the Element Wealth Studio. Stay with us. Studio, we're talking to Douglas Carswell, President and CEO of the Mississippi Center for Public Policy. So you cited, Douglas, at the top of the interview, started in the last segment, that education freedom tops the list of priorities with the Mississippi Center for Public Policy. The good news there is I know you're well aware, and I'm sure you're using that as leverage in talking to our friends down at the Capitol, is that states are really adopting this, and it's getting a tremendous amount of traction. It has been sort of a thing for a while, but it hasn't seen the sort of traction and interest that it has, say, in the last 2 or 3 years. Maybe it was COVID. I don't really know, but a lot of folks are paying attention to it. You mentioned Arkansas, and of course that was one of the first big priorities of the governor, Sarah Huckabee Sanders, upon being inaugurated. She went to work on that. I think they passed very sweeping legislation that could, to some extent, I think, serve as a model as to what would work here. I've done a lot of research on Arizona's program. It's excellent, and by the way, the content that they publish online about their program for students and families and teachers and education professionals is excellent. I will say that about the program. But we've stumbled on this in Mississippi. We haven't been able to get this across the finish line.
Last year, we saw conservatives in Mississippi win a massive majority. The key question for 2024 is, what are they actually going to do with that majority? Are they going to do things that transform Mississippi for the better? Or are they going to just preside over tinkering and, declaratory legislation and feel-good legislation? Or are they going to do something that actually changes Mississippi for the better? If you look across the river at Arkansas, a conservative governor, Sarah Huckabee Sanders, came in and said, if you want to be a conservative in Arkansas, you must subscribe to this idea of school choice. And sure, there were some who didn't agree with her, and some of those are no longer representing the Republican Party in Arkansas. But she took that no-nonsense approach, and as a result of that, every family in Arkansas from 2025 will have an account into which the state will pay $8,000 to $10,000 a year, and they can spend that money at a school of their choice. It is absolutely transformative in Arkansas. It also incidentally means that generations of people in Arkansas who see themselves as Democrat, who voted Democrat, who've regarded themselves as basically without agency, now are thinking and acting and behaving as free market Americans, making choices for themselves and their family. They've been empowered. They've been given agency. It is transforming not only the education system in Arkansas, it is transforming generations of a sense of welfare dependency in Arkansas. It is a fundamentally good and decent thing, and we should be doing it here in Mississippi.
And we should point out that the amount that is available in an education savings account in Arkansas is not the full amount that the state allocates. I think it's 90%, if I'm not mistaken. And it's also phased in. It's kind of, let's get this thing started until we go total universal.
Just for the clarity of your listeners, I prefer to call it the Education Freedom Account, not the Education Savings Account. And the reason is because we, focus group, tested this. When you say Education Savings Account, people assume that they're having to spend their own money. No, this isn't your money. This is government money that you are then put in charge of. And giving every family in Mississippi an Education Freedom Account, it would be transformative.
So I'm not certain and don't have a great deal of confidence that universal education freedom is something we could get passed in our state legislature. And by that, you know what I mean by that, is that if I currently have a student enrolled in a private school, and this is the case in Arizona, universal school choice, if you will, that I could apply for an ESA, and that money would be available in the form of a voucher to actually reimburse my private school tuition, even if I'm already in a private school, have a child in the private school. The Arkansas approach, as you know, it limits initially eligibility to students with disabilities or homeless students, foster care students, active military families, students living in group homes, et cetera. And then it kind of phases in ultimately to get to universal. don't you think that maybe a phased-in approach is something that we could get done here in Mississippi?
By all means, phase it in if that helps win people over. But it's got to be universal ultimately.
Okay.
And I think there's only one restriction that I would emphasize. If you have a very successful school, whether it's public or private, that school doesn't have to take someone.
That's right.
A school can say...
They're not compelled to by the law.
A great school in Madison or a great school in wherever can say, do you know what, we're oversubscribed with local people. And you shouldn't be forced as a school, public or private, to take someone.
Totally agree.
But apart from that, I don't see why there should be any restriction at all.
Okay, so and then their program in 2024 and 25 in Arkansas, it's available to students in public schools that have a D or F rating. Mm-hmm. They could then access those accounts for private school or another public school.
We've got to be a little bit cautious in Mississippi about being bought off by this so-called incremental approach.
Okay.
Because remember what happened with charter schools. Eventually, they had to concede charter schools, so they created an authorizer board, almost mandated to say no.
A non-authorizer board, you mean?
A non-authorizer board.
That's what we get.
An almost Soviet-style non-authorizer board. We mustn't allow incrementalism to actually blunt reform.
I'm with you. I agree with you on that. South Carolina also has an interesting approach where the accounts are available based on your income level, and they phase up to 400% of the federal poverty level.
Also, don't allow people to automatically get an opt-out. People in the legislature to get an opt-out by saying we'll only make it available for C and D, because there's been so much grade inflation
that the
number of states, number of counties that are rated C and D has diminished. And incidentally,
like 6 in the whole state.
The whole point of universal school choice should be that it should be for American mums and dads to decide what constitutes an A-grade school for their child. It may vary. The idea that you should defer to a bureaucrat to say, actually, you live in this zone, therefore you're entitled to this. No, it should be universal.
Yeah. So, as you know, there are a lot of folks who oppose school choice in the state of Mississippi that on the basis of having public money be used for private education. That comes up a lot. So what I've said, Douglas, and hopefully we can all work together on this, is that I think that the case made positive for school choice is evident, and it's fairly pervasive. There's just so much positive about it across the country, honestly, about the concept. I think what we've got to do is focus on the objections, the people who don't see it this way, who don't support that. We've got to, I think, do a better job of countering their objections in resolving those.
We do, and there are legitimate concerns, and we need to listen to those. But we must also be clear that inertia always comes with an excuse. And sometimes when, for example, you hear a lawmaker citing constitutional objections,
I've seen that.
Given that we've categorically demonstrated that those constitutional objections are nonsensical, we mustn't allow people to invoke excuses. You've got a massive conservative majority. What are you going to do with it? If you're against the idea of American families being able to spend their tax dollars according to their preferences and what's right for their families, perhaps that's not really a very conservative thing to do. Fundamentally, we need to recognize that, yes, it's nice if you can achieve consensus for change, but change doesn't come about through consensus. Change happens when people advocate for something different to what we've got, and we've got to be prepared to advocate a little fiercely sometimes against people who don't want to see change simply because they're wedded to the status quo. It's not a great status quo. It really isn't. Yeah. Look at the education outcomes for many kids in Mississippi. We've got to make the big strategic changes that Arkansas has made, and increasingly we hear Alabama's about to make them. The governor of Tennessee has recently embraced this agenda. Louisiana is doing. We mustn't be a holdout state on this issue.
Yeah, I agree. I've heard some lawmakers, I'm sure you have as well, that represent districts that have very high-performing public schools, and basically they say I'm just not hearing that as a priority for my constituents. But what about the rest of the state? As a lawmaker, you got to have concerns about the whole state.
If you represent an area where everyone's happy with the way things are, then you've got nothing to fear.
We don't, and that's the point that I'm trying to make, is that it's the boogeyman, school choice, is that nobody wants to tear down what's working. Yeah. Nobody wants to change what's working here.
Absolutely.
And do no harm. Absolutely. In fact, we want them to all get better. I'd love for them all to be legitimately A-rated schools.
I've quite often heard two contradictory arguments. I've quite often heard people say, this isn't needed because all the public schools in my district are so wonderful.
Yeah.
But then I've also heard the very same person say to me, I worry it would take money out of the public system. You can't have it both ways.
Yeah.
Either they're good, in which case people won't opt out, or they aren't so good, in which case, why are you against not letting people opt out?
Yeah, I've actually made the point that if all the private schools in the state shut down and suddenly all those kids enrolled in public schools, it'd overwhelm us financially.
Yeah.
We couldn't handle it. Yeah. We couldn't accommodate it. So these people are paying taxes but not using the services. Yeah. And that, to some extent, you could argue is subsidizing the public school system. Douglas, appreciate you coming in, man. Happy New Year.
And to you.
I'm sure we'll be talking to you some more. And
thank you
we'll
so
be
much.
Working on these very important issues. Thanks for your advocacy.
Always a pleasure. Thank you.
You got it. We're coming right back in the Element Wealth.